Great. Well, welcome once again to the best practices and resources for developing effective health education for Indigenous MSAWs. We're excited to get started and explore the important topics we have lined up for today. Our learning objectives for today are: understand the importance of effective health education and language access services for Indigenous, migrant, and seasonal agricultural workers. Identify best practices for culturally and linguistically appropriate health education, and access tools and resources for effective health education and outreach. So if we're ready, let's get started. Next slide, please. So let's begin with the importance of language access services for this population. Next slide. Some of the common challenges we have heard from training or technical assistance activities, outreach, research that we have done with Indigenous workers when they try to access care are language barriers. And we know language barriers can cause confusion, either medical terms, medications, procedures. We also know that even within this population in different languages, there's different dialects, different varieties, different regions. And these can complicate communication with service providers and the health education and treatment they receive. They also may come with different beliefs, different cultures, and that can affect how they seek care. They may also struggle to communicate these beliefs to providers, leading to misunderstanding, sometimes even discouragement to seek care. They may also face fear of discrimination or worry about being judged. It can really stop them from seeking care or asking questions if they have these feelings. Also, frequent moves to different areas. This is particularly important for agricultural workers, as we know some of these workers move from season to season to different locations. And it could be harder to find a place where they provide consistent care in their language. So that's another challenge that maybe if they're in Florida, in the citrus farms, and they find a health center, but then the next season they have to move to another state, that might be hard to find care in their language. Next slide, please. But why, we already saw the challenges, but why is it so important for Indigenous workers to have services that value their language, right? Well, we know, as we mentioned, it improves their communication, right? They're able to communicate with healthcare providers, with enabling service staff, CHWs, outreach workers, and understand them. They're able to increase or enhance their trust, because when they can speak their language, they can feel more comfortable and trusting of healthcare providers. They can feel encouraged to seek care. I'm going to go to a place that they're understanding me, what my concerns are, and I'm understanding what they're telling me, their treatment, their medication. It might reduce any errors or misunderstandings, right, when dealing with treatment and health information. It also helps. It also helps offer cultural relevance, right? Language access allows for the inclusion of their cultural beliefs and practices within the healthcare. And lastly, it fosters community engagement. When a health center, Farmworker serving organization offers language access, it promotes participation in either health programs, initiatives within the community, right, as well with other partners. Next slide, please. So now, what are some of the common barriers that health centers or farm worker serving organization may face when they are trying to provide these language access services? Well, we know kind of number one that we've heard a lot is limited resources. Many health centers lack the funding and staff, right, needed to provide adequate translation or interpretation services for all their patients. There is a shortage of multilingual staff, right? There might be some difficulty in either recruiting or retaining staff that speak multiple languages. There might be lack of inconsistent training on either cultural sensitivity, language sensitivity, cultural competency, and this can impact their care quality as well. Next slide, please. Some of the other ones that we have heard are technology barriers. This is particularly important for agricultural workers, as we know that they work in remote areas. And a lot of the times it's important to be able to reach, but in a language that they would understand. So that's definitely a challenge. The next one is awareness of patient diverse language needs. Health centers may not be aware of the language needs of their populations. Maybe there's needs for screening and finding what those languages are. Maybe outreach to see the areas around and what are the most spoken languages and where the care could be more impactful in that language. And lastly is a major challenge is in health education for Indigenous agricultural workers is a lack of culturally and linguistically appropriate resources. Because when health education isn't tailored to their language or cultural context, it can be either misunderstood or ignored because one, they might not understand, or two, they might not feel relatable. So these past three challenges, you will see they have a red star. And we did this because we'll be focusing on this and we'll be exploring more strategies and best practices to address them in this session. Next slide. And without further ado, let's hear from my colleague, Lisbeth Gall, who will be sharing best practices and strategies to expand language access among this population. She's going to guide us through effective approaches and key strategies to ensure that language access is a priority for Indigenous agricultural workers. Take it away, Lisbeth.
Thank you, Ashley, and hello, everyone. Thank you again for joining us today. And I will be presenting a few tools and resources that our team at NCFH, in coordination and collaboration with many individuals, partner organizations, and of course, many agricultural worker communities have helped us develop. Next slide, please. First, I want to invite our participants to share in the chat, if you can, what are some of the languages that you have encountered while working with migratory and seasonal agricultural workers? And it can be any language. We know that Spanish is one of the most common languages, but if you could share, we have here in the chat, Spanish and English. Any other languages that you have encountered? I'm just curious to hear from you. And it's okay if you cannot spell it well. Well, we're all learning together. Quiche. Wonderful. Mixteco, Triqui, Zapoteco. Wonderful. Thank you for sharing. And it's really important. We're going to be looking at the differences and of these languages and learning more about these resources. So thank you for sharing in the chat. Next slide, please. Well, I don't know if many of you know, but according to the US Census, almost 1 in 5 people in the United States speak a language other than English at home. And many of them are limited English proficient. So this is a very interesting map that shows us the most spoken languages in every US state besides English and Spanish. For example, in the state of Texas, besides English and Spanish, the most common language is Vietnamese. We go to California, we see that we have Chinese, and along the East Coast, we have French, Korean, Haitian Creole, and so many different languages, right? And so it's amazing to see the language diversity that we have. Next slide, please. Now, when it comes to agricultural worker communities, we don't have a lot of information. Recent farm worker assessments in the US have found that almost 1 in 3 farm workers self-identify as Indigenous, either racially or linguistically, and 11% of them speak more than 20 different Indigenous languages, which is a very small representation of the true language diversity among all the US agricultural workers. And so here is a list of different languages that our team at NCFH has encountered through different community assessments in different counties in the US. So for example, here in the list, you see English and Spanish, French, Haitian Creole, and then we see a long list of indigenous languages, right? That goes through the second column. But that is not a comprehensive list. And you will see here languages that you probably have never heard of before. But that has been very important for us to understand that we need to learn more and more about their culture and, of course, the language to be able to meet their needs. Next slide, please. Now, you can see here a few languages listed that are that exist. Indigenous languages exist in Mexico and Guatemala. And you see here in the slide, Mexico has 68 indigenous languages and approximately 364 language varieties, which I am going to define in the next slide. But I just wanted to pause here for a second because oftentimes we think that people coming from Mexico or Guatemala or any other country from Latin America may speak Spanish, right, as their first language. But for many of these people, their first language is not Spanish, right? And so it is very important to understand the language and cultural diversity so that all the health education efforts that we, do can really cater to their needs, is appropriate, and it's very important to first understand this language diversity so that we can then learn and better provide language access services, find good interpreters, and find good translation services as well. Next slide, please. One first resources I'm going to share, and I'm going to share a link here in the chat as well, is this tool called Identifying Indigenous Languages and Language Varieties from Mexico and Guatemala. So this number of languages that we see here are very different among each other. Language varieties are known as variants as well. And they are distinctive forms of a language, and they can have similar language systems, like grammatical structures, but they can be completely different from one another. For example, I have here in the slide the language Triqui, right? And it's one of the examples you provided to in the chat. And for example, if I ask an agricultural worker where he or she is coming from, and they tell me they're coming from San Juan Copala, then I'm going to understand that they are speaking the San Juan Copala variety of Triqui, because not all Triqui speakers are going to be understanding each other. And that is when things get very complex when it comes to finding interpretation and translation. Because, for example, if I think about the language Mixteco, not all of them, not all the Mixteco speakers are going to understand the same variety. And I need to understand the towns or the regions where they're coming from to be able to pinpoint what is the variety they are speaking and find the appropriate interpreter or translator, right? And so this material that I'm sharing here provides different tips on how to identify the specific language variety. And how you can also work with interpreters, because they will be able to give you more tips. If you sometimes can perhaps have a recorder and share it with an interpreter. And there are different ways that you can identify the language variety for your audience and the communities you're working with. Yes, and also Esli is sharing here, these resources also have this QR code here. So when you access the slides, you can access these. They are available on our Language Access Resources Hub. Next slide, please. So the next resource we have here is a directory of Indigenous language interpreter organizations. So we put together this material, and it contains the information of 9 organizations who provide interpretation for translation and translation services for Mesoamerican languages. And these interpretation organizations have received some sort of training, and you will see that there's more information about them, the types of interpretations they provide, and some of them offer the rate here. And you can contact them if you are in the search for a good interpretation organization that is reliable and that has trained interpreters as well. Next slide, please. We also have this other resource. It's called Utilizing WhatsApp for Real-Time Language Interpretation on Agricultural Work Sites. Our team here at NCFH conducted a pilot, and then they tested, interpretation using WhatsApp to deliver health education to a group of Tzeltal and Tzotzil workers. And so this tool provides, the examples, lessons learned, and some of the tips that you should consider when using this free app. But, it's another alternative method that you can utilize if you have an interpreter virtually, and you have a group of people that you would like to provide health education. Next slide, please. And then we have here another tool, and this is more for those who conduct data collection, for example, it also offers recommendations on how to select an interpreter, how to onboard them, and how to work with them, right? And this is more specific on phone interpretation, and it gives us, some experiences from the workers on how they feel when they, respond to a specific survey that perhaps, ask them more personal questions, and how do they feel when they have an interpreter, and their experiences, the feedback, and some recommendations when you have to do that. And so this is also for academic institutions or anyone who would like to work with a group of people. And this pilot was conducted in agricultural worker communities with Tzeltal and Tzotzil workers. And our partner organization also worked with Karen and Burmese speakers. So it's a very useful tool, and I'm adding the links here in the chat if you want to access them. So yes, next slide, please. Yes, and all those resources, you can find them again in our Language Access Resource Hub, and they have great recommendations for you all. But now we are very excited to have our guest speaker today here, Dr. Elizabeth Kinney. And she's our invited speaker and expert on this topic. And so she's going to be presenting her experience and sharing a lot of knowledge today. So thank you for being here with us. And I'm going to pass it over to you. Thank you.
Hello, everybody. Good afternoon. My name is Elizabeth Kinney. I'm the Director of Clinical Operations at Bluegrass Community Health Center. A little bit about me. I got my undergrad degree from University of Kentucky. I'm from Lexington, Kentucky. I have a nursing degree and a Spanish degree, and then I got my doctorate at the University of Kentucky as well as a nurse practitioner with a focus in family studies. I started off at Bluegrass Community Health Center as a nurse practitioner. We are an FQHC with HRSA funded grant in Central Kentucky, and we'll go over that a little bit later. I was there for about a year and then moved into the director role, where I oversee our clinical staff, including the nursing staff, nursing assistants, and our care coordinators, community health workers, referral coordinators, and our outreach team. Next slide, please. This is a little bit about Bluegrass Community Health Center. We were established in 2001 through Eastern Kentucky University as a clinic for migrant seasonal farm workers. Our founder saw that we had a lot of migrant workers without access to healthcare. This was the first in Kentucky. We became an FQHC, the Federally Qualified Healthcare Center, in 2006 as a co-applicant with Eastern Kentucky University. In 2020, Bluegrass Community Health Center, we broke off from and made our own independent Federally Qualified Healthcare Center right before COVID happened. The mission of Bluegrass Community Health Center is to provide an accessible health home that promotes better health, better life, and serves all people with care and respect. We're a patient-centered, integrated medical home that promotes comprehensive primary care for adults and children. We do primary care, acute care, behavioral health, and pharmacy services. Our focuses are on agricultural workers first. We have branched out into other different groups in need, including our refugee community, homeless population or unhoused, our in rural health, and school-based setting as well. We have 3 fixed sites in Central Kentucky and Lexington, Kentucky, and 1 fixed site in Winchester, Kentucky, which is more rural, and we have 1 mobile clinic. Next slide, please. This is a little bit about our population. In 2023, we served over 10,000 patients in an 8-county service area. And you can see we're really central Kentucky. We have the 8 different counties because of the farms, because our goal is to reach out to our migrant farm workers in our central area. We wanted to reach 10,000 patients by 2025, and we reached that within 2 years of setting that as our strategic goal. So we are growing rapidly. When I first started, we had about 50 employees, and now we're up to about 130. So that was just over 4 years ago. So there's definitely a need, and we're definitely growing to accommodate that. From the population served in 2023, over 4,000 were Hispanic, Latino, or Spanish of origin. 1,602 were agricultural workers or their family members. And our income percentage or poverty level, we are 100%. We had almost half were 100% or below that poverty level. And then 160 were over that 200% poverty level. And then you can see our Medicaid and our level of uninsured. We see the highest uninsured in a FQHC in the state of Kentucky. And at the bottom here, you can see the top languages that we accommodate at our clinic. And Spanish is our second one after English, of course. And there's all the dialects like we talked about earlier that go along with that. And then we also have a lot of patients that speak Swahili, Kinyarwanda, Arabic, French, Nepali, Pashto, Ukrainian, Persian, and Chinese. So along with the Spanish and English, those are our top languages spoken at our health center. Next slide, please. So how do we compare to other states, like as far as agriculture? So we are #1 in the horse and equine sales. So like it was mentioned, the migrant workers, you know, that is very hard to connect with. I feel like it is even harder sometimes to connect with the horse industry, because instead of being like a whole season of agricultural farming and they're there maybe a couple more months, sometimes our horse agricultural workers are here 2 weeks and then they're gone. So we really got to do as much as we can for them in such a short amount of time. Our second biggest agricultural production is tobacco sales, and that is more of a season, spring to fall. Third is grass and hay production. Fourth is other animals or animal products. We're also fourth of number with farms of cattle in the U.S. And we are the 6th in the U.S. for total number of farms for the state. And here you can just see our top commodities and what our farms look like in the state of Kentucky. And this was all from the Census of Agriculture for 2024. Next slide, please. So what do we do to really help promote language access? So having multilingual staff. So this was a big push that I really helped start at our organization, because I really wanted our staff to look like our patients. I think that is key, to be able to connect. And a lot of our staff were patients, and I'll talk about that a little bit later. So 44% of our staff speak more than one language. And of course, translating material is key. You cannot you cannot overlook that. And that could be as little as a sign that you have posted in your clinic, or your visit summary or handouts that you provide to staff. That includes your screening tools like our PHQs, our GAD, stuff like that, that helps screen. You need to have those in your respective languages that you serve. Prescription instructions. We started a pharmacy a year ago, and a big key to help with adherence to medication is making sure the patient understands that, and you have to meet them where they are in their health literacy. So having instructions, going over it with them. We started to use WhatsApp, like was mentioned earlier. It's very important to use the tools that are available to help connect with the patients. Social media, posts that we do on social media are always going to be in Spanish as well. And like I said, signs around the clinic. Having a good interpretation option. And that can be difficult because we have tried multiple different interpretation companies. So finding that one that works for you in your organization. I feel like we've done better, of course, with in-person interpretations as best as we can, but having a service that maybe can get on an iPad and do more face-to-face via the iPad is really important too. But having it accessible at every location. We have a lot of staff that are outreach that go out into the field, and of course they speak different languages as well, but maybe they come across someone who doesn't speak their dialect or their language. They have access through our interpretation services on the phone too when they're out in the field. And then health literacy, that's important. We can't all assume that our patients understand their written instructions, how to take that medication, how to manage a chronic condition or acute condition. So screening to know their health literacy gives you an idea of the steps you need to take to make sure that they fully understand it. And something that we've done more recently is we've tried to do more videos with instructions on it. For example, our colon cancer screening fit test. I don't know if anyone's familiar with those, but it's something that you would take home and bring it back. And it will do a screening for colon cancer. We were seeing that we were having a really high rate of tests completed incorrectly. So we recorded instructions in our top 10 languages, put a QR code with a sticker on those tests. We still would explain it to them while they are in the clinic, but then we'll say, hey, you can scan this when you get home. If you forget, if you need to walk through it again, there's instructions in your language with a video of how to use it. So thinking about those things, when you see problems arise, just brainstorming and figure out different ways that you can help connect with patients to meet their needs. Next slide, please. So what challenges have we faced? Finding staff, of course. So when I really wanted to bring diversity to our staff, I called around to other organizations in other states and asked, what do you do to bring in your staff? And fostering an environment that promotes diversity. And if you start to get one or two, more will come. And that was what I was taught, and that is definitely what I saw. I have some of the best employees that I got referred from another employee through another employee, or they're excited to be given that opportunity. And that has definitely helped with retaining staff as well. Like I said, a lot of our staff were patients. They're in it for the mission. You definitely need to really focus on that mission, drive that, and really connect with the staff and the patients, because a lot of them maybe didn't speak much English when they started. And I have multiple staff that were taking classes, and I'm like, look, you're going to learn more working here in the next few months than you have in your last classes. So being patient, and you will find the staff that will be committed to your organization. And then translating. Like I said, we have a lot of staff that speak multiple languages. They definitely help with translation. We have companies that help with translation, and then having multiple different staff members reading it to make sure that they understand. And going into that translation is having that option to use a translation service. That is expensive. It really is. But thinking about ways to get funding for that. So almost every grant that we write, we incorporate funding for translation services. You just have to incorporate it in everything you do And you can support that with showing the data of your patient population. And like I said, culture awareness, that's key, because having a diverse staff, you have a lot of different backgrounds, which is the case no matter what, but you have to take into account diversity and in the culture that comes with it. So we tried to incorporate that in our staff meetings and how we connect with our patients. And it's definitely brought our staff together. And it's very exciting to see the different things that you can do with such a diverse staff. Next slide, please. And so these are more things of how you can support languages at your organization. So something we started a couple years ago is we started teaching Spanish classes for staff. So we had a lot of staff that spoke Spanish, but maybe they didn't know the medical Spanish. So it wasn't just for beginners. It was good for our staff that maybe wanted to learn more about medical Spanish, and then our other staff who just wanted to learn to be able to communicate better. So that was a really fun initiative that we started. Like I said, adding funding for costs for language support into any grant that you write, it's key. We do a lot of groups. So our community health workers all conduct groups with patients in their respective languages. For example, we have a pre-diabetes group that's in Spanish. We have a alcohol group and alcohol abuse prevention group that we have in our Congolese community. So we find different needs or see different areas that we should target and really try to bring our patients and our patients' family members together to show that connection and give them some support. Cultural competency, we always do yearly training with all of our staff on cultural competency. We do provide extra pay for any multilingual staff. So that's also another extra bonus to help promote the multilingual staff. Again, grants to assist with language access for patients. We definitely celebrate our different cultures at our organization. We strive to hire staff that look like our patients and support staff. And that looks like not just your upfront front office and clinical staff that are working daily with our patients, but the ones behind the scenes, like our care coordinators, referral coordinators, peer support, and outreach. It's definitely important to have support staff as well that's very diverse. Next slide, please. And this is our support team. We have community health workers, care coordinators, peer support, behavioral health that includes licensed clinical social workers and our psych nurse practitioners. And these are the languages that are spoken by our staff at Bluegrass Community Health Center: Spanish, Swahili, Lingala, French, Kinyarwanda, Ukrainian, Russian, Pashto, Dari, Nepali, and Arabic. Of course, the majority speak Spanish, and that's across the board from our front office staff, clinical staff, providers, care coordinators, peer support. We have a lot of our staff that speak Spanish. Next slide, please. It's also important to reach out to the community. So, for example, the picture on the top, this is Centro de San Juan Diego. It is 2.5 miles down the street from our main site. And they reached out to me and were like, hey, we really want to put a health center in here. And how can we help bring more of the community to get health care established? And I honestly, I was a little skeptical because I'm like, it's 3 miles down the road. Is it really going to be new patients? But it was. We started there as outreach and just tracked how many patients who we were seeing, were they new, were they established, how long have they been here in the US, what's their country of origin. And the majority were new patients, even though it was so close down the street. So we grew, and then now we have a clinic inside there 1 day a week for 8 hours. We go in the 11 a.m. to 8 p.m. So try to have that evening shift to help with this community. And it is growing. I do see us expanding hours there in the near future, but we've been able to reach a different community that we weren't reaching 3 miles down the road. We do a lot of outreach to local farms. right now is our peak season for this because we do come with our flu shots and our updated COVID vaccines, but it's also horse racing time as well. It's a good time to get vaccines in and screen for diabetes and hypertension. We also have a mobile clinic, which is definitely a passion of mine. We can build all these beautiful buildings, but it doesn't mean people are going to come to us. So I think it's important to go to them. So having that mobile clinic with a staff on wheels to go to them, we've definitely been able to connect with very vulnerable patient populations. And different community partners is important as well. And that's just getting out into the community, meeting, talking, it'll grow. That was one of my, when I first started, I was like, how am I going to be able to connect and know all these different organizations? I'm from here, but I still don't know this. It comes over time. One thing leads to another, which leads to another, and you grow your community partners for sure. And of course, word of mouth. Next slide, please. Any questions for me? I do see a couple in the chat. What website do you use to post employment openings? So we have it on our website, and it also is connected with Indeed. But like I said, I get a lot just from internal employees. They'll say, hey, when something gets posted for a clinical assistant or a nurse position, let me know, I have a friend. So you just kind of keep those in your mind to help really get a good variety of staff as well. And culture humility might also be another training that is helpful, different than cultural competency. Definitely, we do incorporate that with our cultural competency, but cultural humility is definitely important for this population and a lot of underserved populations.
Thank you, Elizabeth. This was a great snapshot of the great work you've done. And I do have a question. As I was listening of all the incredible work that you've done, has it been challenging to secure leadership buy-in when it comes to funding? I know you mentioned that you have a lot of positions that you open with these initiatives and maybe the mobile clinics. I guess if you can share some of your strategies and if it has been challenging to kind of reach those milestones.
Yeah, absolutely. Something like with our community health workers, that was a challenging in the beginning. We found grants to help fund them, but now Kentucky lets us bill for their services. So initially putting them on a grant and then getting them certified so we can bill through their services is key, and they help our outreach team. Something else that we've done, like with the mobile clinic, that was definitely a passion of mine. It's not a money maker. It isn't, but if you show the data that those vulnerable patients you were able to connect with, and you'll be able to get buy-in. For example, for the first year we did the mobile clinic, I tracked how many patients we saw in the mobile clinic for each site, how many were referred to behavioral health, how many had follow-up appointments in the clinic, how many had prescriptions sent to our pharmacy. So maybe we weren't getting a lot of reimbursement for the medical visit, but we showed X, Y, and Z things that came out of seeing those vulnerable patients at our mobile clinic that really helped get buy-in for administration and our board to say, okay, yes, we aren't going to make a lot of money having this, but having this service, and even if we're connecting with 4 or 5 patients at this particular site, look what all we did for those 4 or 5 patients and maybe didn't see a provider in the last 5-10 years, or we connected them with the services that they really need. You can definitely get buy-in showing those type of numbers.
Great, thank you.
So one more question, curious about opportunities for training farm workers with PPE and other healthcare prevention services to protect vulnerable populations. So yes, we do a lot with, when we go to the farms and do outreach, we do a lot with tobacco sickness. So that's when you can get like a nicotine poisoning from being out in the tobacco when it is moist, and you can absorb it in your through your pores, and also different chemicals. So providing that education of what that looks like and how to prevent it. Of course, sun and heat exposure is a huge topic right now. So providing that at our different outreaches. And then PPE so reminds me of COVID. So we do try to offer different PPE to our during outreach as well, including masks and COVID tests, and just trying to connect them with different education as best as we can in those sites.
Thank you, Elizabeth. I think we have another question right above that.
Oh, did I miss it?
What are some ways that students, academics, and or researchers can become involved in health education development for agricultural workers?
Yeah, so I've gotten involved with our local university, University of Kentucky, but reaching out to those larger institutes, there's definitely different groups that are interested in some of that research that goes with it, and then also being open to having students. That also helps as well. So I know sometimes it is a burden on some staff to take in students, but being able to take them in and support them, and they see what you're doing, they go back and they remember that for their whole career. So that definitely grows that as well. But we've done research like with pap smears and HPV testing with our migrant farm workers as well through Markey Cancer Center at the University of Kentucky. So that just goes back into like those community partners connecting, because it will definitely grow if you do that. So I would definitely recommend going to a large university or somewhere that is close to your site and seeing if they have anything similar to that.
Thank you so much, Elizabeth. And definitely, if you have more questions, you can send them via chat. We want to thank you because I think through your showcase, you kind of give a why is it valuable to incorporate this language access, because you're impacting lives of people that probably won't be impacted with all these strategies in place of products that are in their language, in their culture. So we're very thankful for your presentation. And building upon the importance that you mentioned of developing health education resources, whether you mentioned posters, maybe some digital media videos, we're going to go to our next section. So next slide, please, where we're going to learn some strategies to develop culturally and linguistically appropriate health education resources for Indigenous agricultural workers. Next slide, please. So when we think about different strategies to develop culturally and linguistic health education resources, there are a couple of things that we have seen successful in the field from either health centers, ourselves, because we do produce a lot of health education, and also other organizations that are directly working with them, or CHWs, outdoor outreach workers. So of course, we want to engage Indigenous communities. We want to engage the community that we are serving, right? Whether it is by including them in the planning and designing of your health education. We do a lot of focus groups. We have tested some of our resources, and you will have a chance right now to look at some examples where we ask them, is this understandable? Is this material in simple language? Do you feel connected to the images that you're seeing, to the symbols? Are there colors resounded? Are they eye-catching? Have you learned something about it? So definitely it's very important. The other thing that we have seen is the importance of community-focused messaging, right? Most of these populations, they value their communities, right? So when we add community-focused health education, it is very effective. And I'll give an example. When we are promoting vaccination and we'd say, we encourage you to access this vaccine for your own health and your family and your colleagues and your friends. And we have seen that has been very successful because they are community centered. They value their family, friends, the people around them. Of course, we want to use appropriate language. We want to discover what those languages are. Our recent work has shown that we have, for Indigenous workers, we have their dialects, but then there might be different regionalities, depending, it might be, let's say, Triqui or Mixteco, Zapoteco, but it might change if they're in the northern or southern areas within a state or an area. So it's important to invest in understanding what language is the one that they will understand or most impactful. The next one is to respect and integrate their cultural values, right? Their traditional health knowledge. A lot of our audiences may have remedios or remedies from their grandmothers that we have to be sensible and have that sensitivity to acknowledge, right? That they know it and not dismiss, right? Because this encourage building the trust. Also, we incorporate visual, audio, and hands-on learning, right? Where we have seen a lot of our workers might not be able to read, so we want to make sure that we are offering other strategies so they can still access the health information in their language. We also use local media and technology, developing of public service announcements and that are short, engaging, easy to follow and understand, and we connecting with local radio stations. A lot of our agricultural workers, while they're working, they might tune in to radio stations, so that might be a strategy that we can implement this health education. We also have the integration into community programs and initiatives, and I think this is a very important one because finding these partners within our community that can expand, right, that health education and help us to be champions. This helps really well when there's a campaign and with other organizations that they trust. I know Elizabeth mentioned a church. Sometimes it's a library, things that sometimes is the laundromat or las guachaterias is very, very common. But these are some strategies where where the cultural and linguistically appropriate health education can be impactful and really get to the population that we are serving. Next slide, please. So definitely, we do have a resource that will walk you through creating community-based health education materials for Indigenous workers. This is a resource developed by NCFH in partnership with the Rural Women's Health Project in Access, Florida. Lisbeth will be sharing the link in the chat, but you can also scan the QR code. It definitely offers detailed steps for developing community-based health education, specifically for Indigenous workers. Next slide, please. And I just wanted to showcase a very quick snapshot of some of the steps that they go over, right? When we think about developing a health education material, it could be a poster, it could be a flyer. Maybe you're doing a quick PSA, public service announcement, or a quick video that you want to showcase in your waiting room. When we think about a particular special and vulnerable populations, such as Indigenous workers, and integrating them into the development, they go over these 10 steps, and I just want to mention them really quick, right? So first, we want to engage the community on what the message should be. What is impactful? You want to know what are some of their fears in regards to a topic? What are some of their common questions, right? Then you grab that, you create your health message. Then you also want to identify what is the language priority that we're looking for the population that we're serving, right? We want to identify what is the message format. And we only know this by knowing, like Elizabeth mentioned, knowing the community that we're serving. You know, I know my community, they always listen to the radio. Maybe that's going to work best. You know, I think posters work really well. They always in the laundromat and I see posters, maybe we post a poster there. So identify the format, right? Then we do our translation and interpretation. Then we develop audio, and something very important that you will see an example is even for our printed materials that are in Indigenous languages, we always provide a voiceover or option as a QR code. And when we have done trainings for our CHWs or outdoor outreach workers, we always tell them that if we kind of train them to train the worker to see like, well, these flyers, and train them how to use the QR code so they're able to access the audio, even if they're not able to read something in their language as well. Then we move over to designing, right? And again, you will see another example right now of a design example where the workers can see themselves and reflect themselves within the design, whether they're images, icons, etc. Then number 9 is a very important one, community review. You've done all this work, but you want to know that you hit the nail, right? That is something that is going to be impactful for them, that they're going to learn that the goal of teaching something and how education is being effective. We get feedback, you work through it, and then we disseminate. So definitely I invite you, if you want to learn more in detail, to visit this guide and download, because it would really walk you if you're interested in developing these health education materials. Next slide, please. And lastly, I wanted to also share what we as an organization particularly do. So when we develop health education products, we do have an agricultural committee. These are agricultural workers who decide to join and be our reviewers. And we have Indigenous workers that particularly bring their expertise, experiences, and we provide, let's say, a flyer or an audio, and we guide some questions. Does this material seem confusing? Does this material, did you understand the main point of it? Do you think it needs additional images? Is it too much to digest? What do you think your community, your family will think about it, right? So we get their insight. And then we include, again, audio recordings. You're going to see an example right now. We also, as an organization, have partnerships and contracts in place with translation organizations. A lot of these are the ones from the directory that Lisbeth shared earlier, that we have in place depending on the language. And we have a process where we send to them and they return to us the translations. And then we test out also these materials with focus groups to make sure they are adequate and are meeting the goal of educating. Next slide, please. So here we wanted just to showcase some examples of some of the work that we do. The first flyer is in Kij, and you will see that it is in their language. In the bottom part, we have a QR code. If an agricultural worker were to come and scan, they will be able to listen to the whole information. The next two, those are social media or WhatsApp images. The same, you will see the images represent the communities that we are serving, and we're providing this education. So we try that our illustrations are able to connect. We also try that the colors are engaging, they're eye-catching. We also, especially for social media and WhatsApp, we try that our message is limited, right? That is engaging. And we always promote our Call for Health program, which is a place that anyone can call and get support to access care or get connected with health centers around them. And definitely we have a lot of these examples in our website of kind of the work that we do. We can go to the next slide, please. And again, this was most of a sneak peek because we will be having a learning collaborative called Bridging Gaps in Language Access and Cultural Competency for Indigenous Workers. And this learning collaborative is a total of 4 sessions that will take you in through language access services, and we will have a full session and workshop on how to put this, everything we learned today on developing health education, in place. And we're gonna have different speakers. It's a 4 session every 2 weeks and starts October 23rd. We encourage, if you want to learn more about this topic, you want to discuss, learn from your peers, and just like we learned from Elizabeth, you're able to have these peer discussions, breakout rooms. So we encourage you to sign up. There's still some spots available, so you can join you can access the link and or use a QR code. Next slide, please.